If there is one thing I hope every girl or a woman that leaves my clinic feeling, it is this: somebody finally saw me.
Welcome to Where Hope Begins, the Save One Life podcast, one country, one community, and one life at a time. I'm your host, Kai, and today I'm joined by a guest whose work has helped shape the entire arc of hemophilia care in Pakistan. Dr. Shahla Sohail is a pediatrician and a woman who lives with von Willebrand disease. She helped establish the Hemophilia Patients Welfare Society chapter in Lahore, now one of the most successful country models Save One Life has anywhere in the world. She was the first person on the ground to partner with us in Pakistan, and she has spent her career advocating for a community that's often invisible inside an already invisible community, women and girls with bleeding disorders. Dr. Shahla, welcome to the podcast.
Thank you very much, Kai, and it's nice to see you today.
Thank you so much for being here. And, I wanted to start off by talking about where this work first began for you. So you are both a pediatrician and a woman living with von Willebrand disease. So when did those
Yes.
first two parts of your story come together?
The people who know me till not so very long ago seem to know me as a pediatrician, and they often assume that the medicine has been my only identity. What they do not see is the other side of my story, which is a little girl who lived with unexplained bleedings, uncertainty, fear long before she became a doctor. My journey with von Willebrand disease and my journey in medicine have never been really separate stories. They are deeply intertwined. In fact, I was my own experience as a patient that ultimately shaped myself as the doctor and an advocate that I am today. In the early 1980s, after graduating from the medical college, I traveled to the United Kingdom to pursue my postgraduate training in pediatrics. While I was excited about advancing my career, I carried another hope with me, a hope that I would finally receive answers about my own health. At that time, diagnosing a bleeding disorder in Pakistan was very difficult. For years, I had lived with a question that nobody seemed to answer. Shortly after arriving in the UK and registering with the Hemophilia Treatment Center, whose answer finally came within days, I was diagnosed one Willebrand's type 3, which was severe. I still remember the feeling. It was not fear, it was a relief for the first time. I understood what was the matter with my body. For the first time, I could look towards the future with confidence and hope. 5 years later, I returned to Pakistan, eager to serve my community and contribute to the health care. But when I came back, I was confronted with a painful reality. The care that had transformed my life simply did not exist here for the people living in this country, that is Pakistan. There were no comprehensive or simple hemophilia treatment centers. Limited diagnostic facilities were available. Very few healthcare professionals were available. And thereafter, I was confronted with this painful reality. The families were still struggling in silence, and the patients were often invisible to the healthcare system. Both a doctor, a patient, I could not ignore this. What started as a concern became a mission for me. Together with dedicated colleagues, many of whom were my lifelong friends and fellow healthcare professionals, we began building something that did not previously exist. We worked with determination, often against significant challenges, to improve diagnosis, treatment, education, and awareness for the people living with the bleeding disorders. At the same time, I became a voice of community that had remained unheard for ever so long. Alongside the patients and their families, we established a patient led organization to bring visibility and dignity and support to those living with bleeding disorders. This was the Hemophilia Patients Welfare Society back in year 2000 in Lahore.
Thank you so much for that wonderful backstory and the work you've done. Can you tell us a little more about how your own experience as a woman with a bleeding disorder currently shapes the way you care for your patients?
As a woman with bleeding disorder, I also had to experience the firsthand the barriers that is always faced by women and girls for many years. Bleeding disorders were considered to be a condition that affected only the males, and only men were inclusive of that club, if I may say so. Women were often overlooked and misdiagnosed or simply not believed. That's why empowering the women and girls with bleeding disorders has remained one of my greatest passions. Through counseling, education, support, we help them to navigate issues private to them, like menstruation, the pregnancy, the delivery, the postpartum period, and then family planning, genetic counseling, and then enabling them to make informed decisions about their health and their future. Today, when I meet a young girl, a newly diagnosed individual, I see a part of myself in her. I want her to know that her diagnosis does not define her limits. She can study, she can work, dream, lead, contribute to the society just like anybody else. My story is not simply about living with a bleeding disorder, it is about turning a personal challenge into lifelong commitment to help others. If there is one message that I would like the listeners to take away today, is this: when a patients are given the right care, the right support, and the right opportunities, they do not just survive, they thrive.
Yes, thank you so much. And that's a theme we hear throughout with our partners is this it's not just surviving, it's how do you thrive with access to resources beyond just medical care. Can you think of a moment in your clinic where you recognize something in a patient that a colleague may have missed because you've lived it yourself?
Quite frequent, actually. The moments that I always seem to remember when I see a young girl or a mother sitting in a corner quietly, and immediately I recognize again a version of myself. Before I was diagnosed with one Willebrand disease, I spent years living in uncertainty. I carried the burden of my unexplained bleeding, pain, fear, and isolation for so long that it became a normal for me. Many women with BWD, I experienced years of searching answers before finally being heard, a journey that is still far too common for women with bleeding disorders in this country. Because I've lived that reality, I often notice what cannot be seen on a medical chart. I recognize the exhaustion behind a smile. I recognize the anxiety behind a simple question. I can see the quiet resignation on someone who has been told for years that what they are experiencing is normal. My colleagues are excellent clinicians, no doubt, but lived experience gives you a different lens altogether. Sometimes a patient does not need another test explained. She needs someone to tell her, I believe you, I understand you, and you're not alone. This is why when girls and women with bleeding disorders come to our clinic, I make it a conscious effort to offer them not only medical guidance, but emotional and psychological support. I know what it feels like to walk into a busy clinic feeling invisible. I know what it feels like to leave without answers. And I never want another woman to feel that way if I can help it. The greatest gift that the von Willebrand disease has given me has allowed me to turn my own struggle into compassion. What once felt like a burden has become a bridge that helps me to connect with the other patients on the other side, earn their trust, and remind them that their voice matters. If there is one thing I hope every girl or a woman that leaves my clinic feeling, it is this: somebody finally saw me.
Yeah, the idea of being seen is one that's really important. I know in the hemophilia community, especially for women. So I guess when we look at the work that you've done, concerning Save One Life and bringing it to Pakistan, what did hemophilia care look like before your partnership with Save One Life existed?
Sometimes, when you partner with another organization or like minded people, it begins with a plan. But others begin with a shared belief that lives can be changed. Our journey with the Save One Life was one such story. Long before HPWS formally came into existence, we were already connected with Laurie Kelly. In 1998, she traveled to Pakistan with a passion for empowering people and strengthening the leadership through workshops, mentorship, and countless conversation. She worked alongside clinicians and leaders, helping them to embrace a vision of compassionate care and meaningful change. What made Laurie's contribution truly special was her willingness to get out of the boardrooms and training sessions and visit the patients in their homes, listening to their stories, witnessing their challenges, and gaining a deeper understanding of the realities that they faced every day. Those experiences were eye openers for her and strengthened her resolve to create a lasting impact. Looking back, it didn't take long to realize that this was the partnership that we were looking for. At the heart of this work, simple but a powerfully belief that one patient and one family, every individual affected by a bleeding disorder, represents a family that journeys alongside with them. SOL was not simply an organizational effort, it was a realization of a vision. Every step forward reflected a commitment to improve lives and building a stronger community.
Since this partnership formed, can you think of a story that maybe captures the whole arc of what it means to partner with Save One Life?
There are so many, Kai, that
I'm
I
sure.
really don't. Over a period of 25 years, the kids that first joined the SOL funding program, which was in my mind, I always thought would be used for educating these kids, these little ones that were just going to enter school at that time. So I remember I have two examples, and one of them is a girl, so I'll go with her first. Her name is Sadia. She was about 2 years old when she was referred to me from the Children's Hospital in Lahore after sustaining a blunt trauma to her abdomen and had bled a lot. And finally, when she recovered, she needed to be registered somewhere. So in those days, we had starting registrations of patients, and Sadia was one of the early little girls that came to be registered. We looked after her for another couple of years before she started her school, and this was funded fully by the SOL, and she used to come every month to get her donation, and then it was paid to her school. The father was a very strangely, the father was very, very devoted to this girl, and I think she owes her life, her well-being, her education all to her father's hard work, which is again something rare in this country because mothers and daughters are more like being teamed up together.
Hmm.
So she went through school very nicely, and she left school at the age of 16 with passing her exams, the secondary exams, with flying colors. And it was at that time that we sat down and thought of what career lines she would be following. You know how people who have been living in and out of hospitals, they live out of treatment centers and things, they really idolize the nurses and the medical staff that have helped them to while over their difficulties.
Mm.
So Sadia wanted to become a nurse. And again, we asked the SOL for the pre-university 2 years training time, and it was a little bit more money than what was she getting monthly for school. The reply came back very positive, and she was given a grant to appear and pass those 2 years. Again, she did very well, and then now it was time for her to do her bachelor's in nursing sciences. At the age of 16, she entered the nursing college, and we arranged some funds from the local donors. And again, SOL was there for her as well. She went through all the 4 years of her training, and she did her bachelor's in nursing sciences and came out as with flying colors as a nurse, qualified nurse. So at that point in time, she decided to work for a semi-private hospital over here, and what she wanted to do was to go into the pediatrics or the emergency room, and which excited her a lot. And that's how she did it. And today she is a senior staff, and she's managing a pediatric unit in one of the private hospitals in semi-private hospitals in Lahore. She comes to visit us. She's become a mentor for other girls. She also comes when we have meetings and symposiums about empowering women and girls with bleeding disorders. She stands up there on the podium and discusses everything about the reproductive health with these girls, reassuring them every step of the way that this is all very good, all normal for us. And if we are getting into a trouble or in a problem, we all will survive and we'll all do very well. Just like I am here and I stand in front of you to prove that it can be done. That is Sadia for me.
Wow, it's such a it encapsulates so perfectly, the mission of SOL, which is not just medical. its, resources for education. And again, I think what we really want to talk about next is the success we've seen with your partnership specifically. You've served more than 300 patients now, and you've trained an entire generation of leaders, including who you were just talking about, who now speaks on behalf. So, what do you feel like you and your colleagues did right when you started the partnership?
When we started this partnership, of course, the first thing was the consolidation of the organization that we had just set up at that point in time, because SOL was there for us from the day one. When we look at the Hemophilia Patients Welfare Society today, we see the realization of a dream that began many years ago. From the very beginning, we had a clear vision of where we wanted to go and the impact that we hoped to create. While the journey was challenging, we knew our destination and believed in our purpose and remained committed to shaping our own future. What guided us through the challenge and the values that became the foundation of our success were, of course, the strong leadership, committed teamwork, did lots of determination, lots of discipline, resilience as much as possible, and effective communication. And
Hmm.
if I may take a minute to say that, for me, effective communication was a problem at that time. This was 25 years ago, because of the fact that we never gave so much importance in our lives before that as much as the communication. But I was even taught how to communicate properly, and SOL helped me do it. So these principles then helped us to transform a dream into a thriving organization that continues to serve and inspire the bleeding disorder community today.
Obviously, it's so evident in the success you're seeing with your partnership. So, if there was another country or community that wanted to replicate what you've done, what would you tell them to do right away?
The answer is not so complicated, but the implementation is the trick.
Sure.
The first and the first most important step is to have a very clear vision and a strong mission. Everybody involved should be prepared to understand and commit to the common goal. Secondly, comes the team. We have to build a dedicated team, the people who believe in the cause and are willing to make sacrifices for the greater cause. Success is never the work of one individual, it gives us the results after a collective effort. Strong leadership and teamwork must go together and they should support each other. The organization only grows in the setups where both of them work with one another and support each other to the hilt, and all to get a shared purpose going. Above all, remember the three key words that and I was taught again by somebody whom I respected very much at that time was discipline, determination, and communication. These are the pillars upon which a sustainable and a successful organization is built.
As we start to wrap up here, I wanted to make sure we touched on, women and girls with bleeding disorders, because I know that's a really
Uh-huh.
important part of your advocacy work.
Yeah.
And one
Yeah.
of the reasons your name keeps coming up in this conversation, what are women in your clinic being told today about their bodies, bleeding, about pain?
The girls come here, they have already been exposed to a lot of what the words are going around, and lots of them are the old narratives, the horrific old narrative that is being bounced around in villages and open spaces in remote areas, even in the urban areas, even in the rural areas. So we have to really look at that and work for it. The old narrative, it was based on myths and misunderstandings. In the last 25 years, we had a concentrated effort to from the youth of the group of girls and the healthcare providers to have a big workshop or a symposium on puberty, menstrual hygiene, consent, family plannings, and when girls and women only seminars, which was attended very well attended because culturally sensitized atmosphere was there, and the women could come there with mothers and daughters as well as women who were sufferers themselves and could listen to all of this that we were giving out to them, telling them that, look, it's high time to stop the hiding and suffering, and let's substitute it with understanding and healing.
As we start to close out, I just wanted to hear your message of hope as you look to the future, because I believe there were some recent developments within your government that maybe seemed unthinkable a decade ago. Can you talk to us about that?
When we started to meet and try to involve the government in the care for hemophilia patients and girls with bleeding disorders. One of the federal ministers that we talked to, and I was sitting right across the table, and I said, okay, why can't you commit anything for our group of people? I mean, we already there, we have done a lot, but we need to, every other person abroad or in other countries want to know what is the government doing it for you? Why the government is not owning you? And he calmly told me that we've got a lot more on our plate than hemophilia. What we will be spending on one of your patients will be enough to get rid of tuberculosis in the whole of Lahore. We can take care of dengue fever, whole of Lahore. We can do this and that and the other. And which I just stopped listening. It was such a disgrace. But at the end of the day, he said, okay, sorry, we just cannot manage them. It's not on our agenda. The list of healthcare problems in the agenda does not list hemophilia anywhere. And that was the end of the conversation. So, in the year 2025, beginning year 2025, we have become so empowered now, and we have got the first leadership people, and then we have the second generation coming up, who are even, more smart, more street smart, and knowing how to tackle these kind of problems much better than what we did. So we were able to penetrate a private sector hospital here in Lahore, which is a children hospital. It is the biggest children hospital in the province of Punjab, where we are, and it is a state of the art institution. We were looking for a place for children because we were now very focusing on little children to provide them an atmosphere where they will have a disability free life, and they will have a healthy life. They will be easily looked after for their medical and surgical emergencies and OPDs and ERs. So we targeted that and we were able to get there. So this tertiary care center for children in Punjab has signed an MOU with us, the HPWS and the HTC here, and now our children all over Punjab who are even not even registered with us can go to the children hospital, who coordinate with us, uses our expertise, and sometimes we also give them the factor concentrates that they need. And we also go and have symposiums and seminars in that government after every 2 or 3 months, and enable the staff and the people over there to become more in tune with what is happening and how we are treating hemophilia patients elsewhere. So it was a huge breakthrough, and I think it's not unthinkable to do anything more in future, but I think we know where the loopholes are, and we
Mm.
can get through there. So I'm looking forward to that.
Yeah. So, it wasn't easy getting government's investment in your mission,
Yes,
but
yes.
now that
But
you've done it for the first time,
first
you
time,
can see
yeah.
maybe the
Yes,
possibilities moving forward.
yes. It's like having your foot in the door. And
Yes.
so we're going to go on from there and, change our tune a little bit and see what comes. So, and the trust deficit is not there anymore. They know that we are committed people and will go to all extents to help them to even raise their level. And which reminds me that we also collected some funds from the donors that we know and who are very generous to even upgrade their lab, the hematological lab, with the latest machines for diagnosis of hemophilia. And for that, they were grateful and very thankful. And then that was the turning point where their attitude changed and they signed the MOU with us.
Wow. Well, congratulations. And for a sponsor who's maybe in the United States, what would you
Yeah.
want them to know about Boys and Girls and Save One Life as who they support in Pakistan?
For a sponsor in the USA who may be associated with primarily with only looking at the headlines they see rather than the lives of the people who live in a particular country, I would want them to know that children everywhere are the same. They are more than their diagnosis is, and they are more than what circumstances where they live. We have our children who are students, dreamers, athletes, artists, and future leaders who simply happen to be living with a bleeding disorder in a developing country. I would want them to know that these children are more than that diagnosis in any case. So, through the support of SOL sponsors, they have gained access to education and essential treatment and medical care and hope. And opportunities have come by to help these children to lead healthier and more fulfilling lives. SOL sponsorship is just not a financial assistance, it's a lifeline that helps these children overcome barriers and envision a brighter future.
Well, thank you again so much for your time, and thank you for your decades of work, what you've given to patients in Pakistan, for your pioneering partnership with Save One Life, making the work, in your country possible, and just for refusing to let women and girls with bleeding disorders remain unseen. So thank you once again for joining us.
Thank you very much for having us. Thank you.
And to all of you listening, thank you for joining us on Where Hope Begins, one country, one community, and one life at a time. To learn more about Save One Life and how sponsorship transforms lives, visit saveonelife.net/sponsorship. Until next time, everybody, take care. Thank you for listening to Where Hope Begins, the Save One Life podcast, because when one life is supported, generations can be transformed. Presented by Save One Life in partnership with Balancing Life's Issues. Produced by me, Kai. Got an idea for the show? Send me an email at kai@balancinglifesissues.com. Did today's story move you? Sponsor a child at saveonelife.net/sponsorship. Anything else to add, Miles?
Yeah,